Good afternoon. Today I'm here to announce that Alberta is ready to safely and cautiously enter Step 2 of our path forward. I want to thank every Albertan who has responsibly observed public health measures through Step 1 over the past several weeks to protect lives and our healthcare system in the process. I know this has not been easy, especially with cold weather in February limiting our ability to gather outdoors. But the sacrifices that Albertans have made are the reason that we're able to take another step forward today. COVID-19 is still here, and it is still very much a threat to our health and our healthcare system. Still, over the past few months, Alberta has made tremendous progress. Let me highlight just a few examples of how far we've come. Our healthcare system, which we all rely on, continues to see a sharp decline in people admitted to hospital and in intensive care due to the novel coronavirus. From a peak of about 950 patients in hospital, we're down to 257 today with COVID-19, about 200 patients below our threshold that we set for entering this phase 2 in Alberta's path forward. Our long-term care and designated supported living facilities, typically called nursing homes, have seen cases plummet. Thankfully, active cases in our long-term care facilities have now declined by more than 95% from December's peak. And the active cases in designated supported living facilities for seniors have dropped by over 92%. So this is encouraging data, and this data speaks to both the sacrifices that millions of Albertans have made, as well as the huge impact of COVID-19 vaccination since we've delivered the second dose to all the residents of those facilities. When we started Step 1 of the path forward on the 8th of February, there were 432 COVID patients in hospital and 76 in intensive care. Today, we have 257 people in hospital, as I mentioned, 48 of whom are in intensive care units. All of which means that we're not out of the woods, but we can continue taking small steps forward as we go into Step 2. Effective today, targeted health measures will be eased for indoor fitness activities and for libraries. As a cautionary measure, possible changes to current restrictions for retail, hotels, banquets, community halls, and conference centers have been delayed, given that we have seen a small recent increase in the testing positivity rate and the number of active cases. Minister Shandro will provide more details on what specifically we will ease for these sectors in a couple of minutes. Alberta is taking a careful approach, as we said that we would when announcing the path forward back in January. While our hospitalizations are dropping, we have seen cases at the same time level off, so the number of active cases has leveled off recently, and the testing positivity rate has risen a bit. We also have observed a small increase in the daily number of new variant cases, and that is worrisome too. That's why we have to proceed cautiously while still moving forward. I know that many Albertans want us to relax many more health measures today, but we cannot and we must not allow exponential growth to start to take hold, driven by these new, more contagious variants, as we've seen in many countries around the world, because to do so would end up in weeks jeopardizing our healthcare system. So we must take a balanced approach and move carefully and safely, focused on the data, and with the expert advice that we receive from the Chief Medical Officer and the public health team. To every Albertan that is worried that we're moving too slowly and who longs for life to get back to the way things used to be, I hear your concerns, I share them. We all want to get back to that place as soon as possible. But for that to happen, the game changer is the vaccine. It is incredibly frustrating and totally unacceptable that Canada is ranked 40th in the world for per capita inoculation against this virus. Widespread use of the vaccine will mean freedom, which is why we renew our urgent call on the federal government to catch up with the rest of the world in vaccine procurement. It's also why we need to be careful now, keeping the virus at bay while we vaccinate hundreds of thousands of seniors across the province. On this, I have to stress the huge importance of avoiding indoor social gatherings. Now that our contact tracing system is on top of new cases with very strong investigations, especially related to the variant cases, we can see good data. With about a third of the cases, we don't know their source of transmission, but for over 30%, we know that they're happening at home, just like in the fall. And so we need to be very careful about at-home transmission. I want to remind Albertans that if you need to self-isolate, if you've got a symptom, if you're feeling sick, you've tested positive, and you can't do it safely at home, we are offering free, voluntary hotel stays with isolation payments to support your finances. To every Albertan that is worried that we're moving too fast, I hear you as well. Please know that we're watching the spread of this virus very closely. By moving to step 2, we are protecting both lives and livelihoods and taking a safe step forward for Alberta. I believe in our province, and I trust that Albertans will continue to do the right thing. Thank you, and now I'll ask Minister Shandro to provide more details about these steps.
Thanks, Premier, and good afternoon, everyone. Today's announcement that we're moving into step 2 is another safe, another smart step forward for our province. Now, it was a little over a month ago that we announced our path forward, and we laid out a clear plan with a clear threshold for each step forward. And now the time to move to step 2 is here. But as Premier said, we're going ahead cautiously, well aware that the pandemic is not yet over. We're confident that these small changes first make sense, but also that they are safe. We're allowing room for folks to do more things that are important to them while keeping strong measures in place to stop the spread of COVID in our communities. And we're making 2 changes. First, we're allowing libraries to open subject to a limit of 15% of fire code capacity, not including staff. And this considers the concerns that we've heard related to the important role that libraries play, in particular in some rural communities where they have limited access to high-speed internet. And the second, adults will be allowed to restart their fitness routines. Low-intensity individual and group fitness activities will now be allowed indoors, like Pilates, Tai Chi, and indoor climbing. And I know that many Albertans are eager to get back to other activities like running on the treadmill. High-intensity activities like that are still only allowed on a one-on-one basis with a trainer or for a household and one trainer. Wearing masks will still be mandatory during low-intensity fitness activity and for coaches or trainers during high-intensity activity, and all participants will need to stay 3 meters apart. Drop-in fitness remains not allowed. We relied on recommendations from the fitness sector in making these decisions, and that includes how we define low intensity. We also wanted to offer more flexibility while keeping safety, and as Premier noted, changes to current measures for retail, children's sports, hotels, banquets, community halls, and conference centers have been delayed. We're being cautious while still moving ahead. While these changes are positive, we can't lose sight of the fact that further easing of measures opens up the chance of spreading COVID. And for that reason, we've chosen to hold off on easing restrictions on retail businesses for now. While we're all excited at the idea of participating in more activities, please continue to remember that the risks are still out there, and please remember to keep each other safe. The variants of concern are, as you know, we've spoken about this before, estimated to be 30 to 50% more infectious than the current strain. And now that the variants are in Alberta, we have to be even more vigilant, even as we ease measures. We're watching the leading indicators very carefully, and we're fully prepared to reinstate measures as needed if trends in daily cases shift. We'll wait at least 3 weeks before we make a decision regarding moving forward with step 3. In the meantime, we'll continue to roll out the vaccination plan administering doses as soon as we get them from the federal government. But we need time to vaccinate those at the highest risk to reduce deaths, to reduce the burden on our hospitals. So please stay the course and abide by the public health measures. And remember the lower that we bend the curve, the more that we can safely open up in the weeks ahead. Thank you very much, and I'll invite Dr. Hinshaw to provide today's COVID update. Thank you.
Thank you, Minister, and good afternoon, everyone. Over the last 24 hours, we have identified 291 new cases of COVID-19. We completed about 5,900 tests, and our positivity rate is about 4.9%. Looking to schools, there are currently active alerts or outbreaks in 236 schools, or about 10% of schools in the province. These schools have a combined total of 890 cases since January 11th. We have identified 35 additional cases of the variant since yesterday, bringing our total to 457. For the past week, the RT value for the province was 1.01. This includes 1.16 for Edmonton, 1.01 for Calgary, and 0.94 for the rest of the province combined. As the Premier noted, currently there are 257 people in hospital, including 48 admitted to the ICU. Sadly, I must announce that 2 new deaths were reported to Alberta Health in the last 24 hours. While it is encouraging to see the rate of COVID-19 fatalities declining, this does not lessen the loss that many Albertans continue to feel from losing a loved one. My condolences go to anyone mourning the loss of someone they cared about. Vaccine is our best path to preventing these severe outcomes, and I am happy to say we have administered more than 235,000 doses of vaccine in our province, with more than 88,000 Albertans fully immunized. Since the rollout of the vaccine to Alberta seniors aged 75 and over, February 24th, more than 123,000 eligible Albertans have been booked to get the COVID-19 vaccine. In just over 5 days, Alberta has provided a first dose to upwards of 31,000 eligible individuals in that age group. We anticipate that another 8,000 were given today. We thank Alberta seniors for their patience as we work through some challenges during the first few days of clinics. I also want to thank the family and friends who helped navigate the online booking system and safely transported their loved ones to appointments. It's wonderful to see so many people coming together to help protect our seniors. I'm pleased to report that the long lines at some clinics have been minimized by new processes that have been put in place by Alberta Health Services. We appreciate people arriving only 5 minutes before their appointment and waiting in their cars until just before their appointment time. I understand everyone's desire to be on time. For many people, getting their first dose is an exciting day, but this is why we have an appointment system. Please know that if you have an appointment, vaccine is reserved for you and you will get your immunization. While we roll out the vaccine, we need to continue to ensure the health and well-being of one another. I ask all of you who have immunization appointments in the coming days to continue to follow physical distancing guidelines. Also, if you are comfortable going into your appointment alone, please do not bring a support person or family member with you, as there are staff who can help assist you, and this can prevent overcrowding. We also encourage everyone to wear clothing that will easily allow access to your upper arm for receiving the immunization, like a short-sleeved shirt. For those who are eligible for the vaccine but haven't yet booked, appointments are still available throughout the province. There are 3 options to book your appointment for receiving the vaccine. These are using the AHS online booking tool, calling HealthLink at 811, or contacting currently participating pharmacies in Edmonton, Calgary, or Red Deer. A list of participating pharmacies is available through the Blue Cross website at ab.bluecross.ca. I also want to thank every Albertan who continues to make sacrifices and work to limit the spread of the virus in our province. By making choices to reduce in-person interactions, you continue to make a world of difference. You are helping limit the spread of COVID-19 limit pressure on our healthcare system, and ultimately these choices have put us in the position we are in today. We have climbed down from the peak in December thanks to the ongoing hard work, vigilance, and sacrifice of many. I know the prospect of slightly fewer restrictions may signal to some that we've turned a corner and can now let our guard down in other areas as well, but this could not be further from the truth. We need to be more careful than ever to not create opportunities for the virus and its variants to spread. The progress that we have made is not guaranteed to last. It is up to all of us to continue lowering cases. COVID-19 still poses a threat to our province, and the choices we make every day still deeply matter. As with the previous step, we will continue to monitor hospitalizations to ensure they're continuing to trend downward, and we'll also keep a close eye on our leading indicators of growth rate, new case numbers, and positivity rate to watch for any concerning shifts that may require us to pause or reverse our current approach. We are being both responsive and cautious, and we will continue to keep you updated in the days ahead. Thank you, and we'll be happy to take questions.
Okay, we'll be going to the phones for questions now. In order to get to as many as possible, we just ask that you limit yourself to one question. Operator, can you please put through our first caller?
Thank you. The first question is from Carlisle Fizette, CTV.
Hi, I suppose it's a question for the Health Minister, a clarification question when it comes to the measures that have been delayed from initially Phase 2. Are they now part of Phase 3? Could they come back sooner? How are you approaching that?
That decision hasn't been made, and so it's not that they've been delayed till step 3. It's still going to be up to the Cabinet COVID Committee, and so it could come before step 3. Those will be decisions that we make as we continue to evaluate the evidence with Dr. Hinshaw in her office.
I would just add to that if the numbers start going clearly back in the right direction with diminishing new cases, and if we can clearly establish that the variants of concern are under control, that the inferred rate of transmission and those other key metrics, if they start going down in the right direction, I think we can absolutely look forward to taking additional steps within the Phase 2. But given the recent plateauing of total active cases, the recent slight increase in the testing positivity rate, the RT rate, we thought it was best to proceed at this point with caution.
Operator, can you please put through our next caller?
James Keller, Globe and Mail.
Hi, this is a message or a question for the Premier and Dr. Hinshaw. What is happening in the Northern Health region? I mean, new cases have almost doubled in the past 3 weeks. What are the theory as to what's going on? How concerned are you? And is there any talk of restrictions for that particular area that would try to bring infections under control?
Very good question, James. Actually, we spent a fair bit of time discussing exactly that at our COVID Cabinet Committee meeting today. We see some parts of the province, the eastern side of rural Alberta from Lloydminster down to the U.S. border, doing very well. For example, at fewer than 50 cases per 100,000, but in the northeast quadrant of the province, which is one half of the North Health Zone, we certainly see very significant increases. One local geographic area with 1,600 cases per 100,000. I think of our top 12 local geographic areas for active cases, if I'm not mistaken, 9 or 10 of those are in the northwest quadrant of the province. So I have asked for more information about what might be causing that. But one thing we do know is that, unfortunately, there have been a number of outbreaks on some First Nation reserves in that area. Let me say we commend our First Nations communities and leadership for having been so careful about COVID from the beginning. We have heard some reports of social activity that may have caused a transmission. So we are renewing our call to First Nations leadership and communities to work with our public health authorities to make sure that people are doing everything they can to comply with the measures. We also saw some outbreaks in care homes in the Grand Prairie area. I believe one was a community care home for people with intellectual disabilities. And Tyler, I think you might have, or Dr. Hinshaw may have the details on the other two there. So there have been a number of outbreaks. And finally, one thing that we can't, what matters here is not simply the stringency of public health measures, but also the willingness of people to comply with them. And we would just encourage people in every part of the province to take these measures seriously. And with that, I'll hand it over to Dr. Hinshaw. Unless, Tyler, you want to jump in as well.
No, all of that was correct, but they were both congregate living that weren't included in the phase 1 vaccine rollout. That's correct.
Thanks, and I would just add that the virus, of course, can spread from one person to many when given the opportunity, and that is essentially what we've seen, is that in some of those environments, in some of the communities in that northwest corner of the province, as well as, quite frankly, in other communities across the province, where we let our guard down, where there is an opportunity for the virus to spread from one to many, it does so very quickly. And so this is, again, a reminder that even in those places where currently there's very low rates, it doesn't take long for the virus to spread quickly if we give it the chance, and we need to keep vigilant so that we do not provide that opportunity for that rapid spread.
Operator, can you please put through our next caller?
David Staples, Edmonton Journal.
Thank you for taking my call. My question is for the Premier and for Dr. Hinshaw. Many people, most people now in long-term care and in DSL-4 have had 2 vaccinations, most of them for at least a month now. My question is, why are they still kept in the strictest kind of quarantine where they're not allowed out of their facility to see loved ones? They've been in lockdown since mid-November. They can't get out. Many of them are suffering from confinement syndrome, which is affecting their physical and mental health. So we know from the CDC that both transmission and them catching the disease now that they've been vaccinated is very unlikely. So under what public health measure are they still under such strict lockdown?
We know that it takes about 3 weeks for seniors after the first dose to see the full impact of that dose, and about a week after the second dose for them to see the full impact of that second dose. So it's important to not just look at the dates when the vaccines have been delivered, but also giving that extra time. We are looking at the evidence when it comes to transmission, when it comes to protection from severe infection. It's important to note that we're still watching very closely, but we don't necessarily at this point have all the evidence that we'd like to with respect to the impact of the vaccines on ability to transmit to others. That is a critical piece that we're watching closely. We are looking at our policies around long-term care and supported living facilities. It's important to note that we have made clear that every resident in every supportive living facility, long-term care, should be able to have their designated support people, so 2 people per resident, visit them at all times, including in outbreak situations, so that they would have the ability to have that support of loved ones, even in outbreak situations, unless there's a specific and unusual circumstance. And we are, as I said, looking at how we may be able to update our visitor guidance, but at this particular moment in time, we just are wanting to get that additional evidence about the impact of the vaccine on the ability for transmission to happen before we make any final changes. And I'll pass it over to, do you have anything? Yeah.
If I could add to that before Premier. David, just to reiterate what Dr. Hinshaw said, that a lot of us want to think of vaccines as protected or unprotected before we've had it or after we've had it, and it's really important to think of judging vaccines in 3 ways. It can protect somebody from a severe outcome like death or hospitalization. It can prevent infection, and it could protect somebody from transmitting the virus. And so 3 different ways for us to be judging, and we do have evidence on the first one on severe outcomes, but for that last piece, that third one, just to reiterate what Dr. Hinshaw said, that's going to be an important one for us to be looking at as we think about pulling back some of the measures, in particular for those who are most vulnerable in long-term care. Premier?
Thanks. I don't have much to add, but thank you very much, David, for the very important question. And we know, and we have to be constantly mindful that the only health risk here is not COVID-19. The the mental health impacts, particularly for isolated seniors, the deterioration in their physical condition that's often attached to that, limited compassionate visits. We know that not only is that inflicting real pain and sacrifice on their loved ones, but most especially on seniors in those kinds of congregate living facilities. So I do hope that I'm looking forward to further advice from Dr. Hinshaw and her team on when it would be deemed safe to move forward with relaxing some of those measures.
Operator, can you please put through our next caller?
Julia Wong, Global News.
Hi, this question is for Dr. Hinshaw and the Premier. So, Dr. Hinshaw, you said on January 20th that sector-specific transmission data would be released in the coming weeks. The Premier mentioned a percentage of transmission happening in households. What does the data show about where other transmission has been taking place? And I also have to ask, the National Advisory Committee of Immunization is recommending that the AstraZeneca vaccine not be given to those 65 and older. Will Alberta be following this recommendation, and will rollout priorities change to accommodate the AstraZeneca vaccine?
Perhaps, okay, I'll defer the question on sector-specific data to Dr. Hinshaw, but I think Tyler might be in a good position to answer the AstraZeneca question.
Please do, Premier. So right now, we have made the decision for AstraZeneca to not be provided as it's recommended by, as well, our own vaccine advisory committee that we have here in Alberta, and the physicians we have, Dr. Hinshaw and her recommendations to not be providing it to folks who are over 65. Now, how that's going to change the administration of those who are in phase 2 is still to be determined. We will be making those decisions and announcing them fairly soon. But you're right that it has been recommended for the AstraZeneca vaccine to not be provided for those who are 65 and older.
With respect to the sector-specific data, we have been watching closely since we've been able to do more investigations since our numbers have been increasing. What we see is that about 40% of our active cases acquired the disease in household. We know that in-household transmission is the highest risk. And so again, want to reiterate the importance of making sure that when anyone in a household starts to feel any symptoms, or if someone in a household is identified as a close contact of someone with COVID, it's really critical within that household to separate people out, and if that can't be done, to take advantage of the isolation and quarantine hotel offer that is available, because that will significantly reduce that proportion of cases where transmission is happening at home. We're seeing about 30% of our cases where we're not able to determine the source of transmission, and that's due to several factors. It could be due to the fact that an individual may have had multiple activities in the 14 days before testing positive or before their symptoms started, so it's not possible to determine which of those activities was the source. And it's really important to remember that in that 30%, there are a lot of activities that are currently open. We know that about 1% of our current cases have been attributed to retail or restaurants, all of those in kind of one category. But again, it's that 30% that's concerning, and I want to reiterate what I've asked before, that if Albertans are identified as a COVID case, it is critical to be forthcoming with the contact tracers to provide all the accurate information about what activities took place so that we can prevent further spread and have a better picture of exactly what's happened in those 14 days before, so that we're better able to pinpoint what activities are risky.
Operator, can you please put through our next caller?
Lauren Boothby, Edmonton Journal.
Hello. I had a similar question to Julia Wong. You sort of answered it, but I was wondering if you could give some more information about why you think that these other activities that are being delayed today, why you're not reopening them based on the science of what you have about how COVID is transmitted, and will you also release sector-specific data about how COVID is transmitted from what you do know from this past year and from last year?
Well, maybe Dr. Hinshaw first before you answer the more specific questions, but just to reiterate that we have spoken before, even going back to when we first announced the Path Forward plan, is that the stepping back of measures, or stepping down of measures, I should say, was going to be focused on the lagging indicators, in particular hospitalizations, but that we also had to be looking at leading indicators and increases in our case counts, increases as well as Premier pointed out in positivity rate and the R value in the province. So looking at that data at that as well at this time, that it was necessary for us to be able to make sure that we are continuing with step 2. We're continuing with a clear and safe path forward for Albertans in stepping down our measures, but doing it in a safe way that is responsible, looking at the leading indicators. And Dr. Hinshaw, for the rest of the question.
Sure. So what I would say specifically about the release of information on sector-specific transmission, we have been working with our analytics team on putting that together. It sounds straightforward, but unfortunately when we dig down into that category of the specific types of activities, it does become quite complex. And so we continue to work on that to be able to provide that overall summary, and it just hasn't been completed at this point in time.
Okay, we have time for 2 more callers. Operator, can you put through our next caller?
Rick Bell, Calgary Sun.
Good afternoon, and a question for the Premier. A while back you told Albertans to really focus on hospitalizations, and it went from 600 and then the next step would be 450 and then 300 and then 150. So how do you explain to people who will no doubt ask after reading the stories that will appear in the hours and days ahead, how we are now almost 200 under step 2, and if the numbers stayed this way on hospitalizations, I believe we'd be in step 3, and yet in reality we are at best at step 1.5. So how would you explain, and they're going to hear all about our values and this and that and the next thing, but you told them to be very focused on hospitalizations. This was the measure. So as that measure goes down, how do you explain to people that we have 257 people in the hospital and we're at step 1.5?
Good question, Rick. So on January 27th, when we announced this path forward, we said that we would gradually move to relax public health restrictions based mainly on reduction in how many patients were in hospital, but that if we saw cases start to tick back up, and if we saw in the leading indicators like new cases starting to tick up, that we might have to go a little bit slower. We were very clear about that from the get-go. At the end of the day, this is all about taking a careful, balanced approach, relaxing restrictions wherever we can safely do so. We do have capacity in the healthcare system now, but recognizing that that can turn around in the wrong direction very quickly, as we saw in the fall. Let's not forget our fall experience where we went from 100 people in hospital to 950 in just 5 weeks. We can't let something like that happen again because for so many obvious reasons. So we were very clear this was going to be a careful, gradual, a step approach. Yes, a key indicator is the number of people in hospital, but as we always have pointed out, it is a, quotes, lagging indicator, which means the number of folks in hospital with COVID is sort of 3 to 4 weeks after the number of infections that you get. And typically it takes about 3 weeks after somebody's been infected if they get really sick, to present at the hospital. And then often they're in the hospital for a week or longer. So it is a lagging indicator. It's an important one. It's a key metric, but it's not the only metric. We would be, frankly, stupid if we were to close our eyes to increases in overall cases. Right now, we have seen a slight increase in the number of average daily cases, the number of active cases, the rate of transmission, and most worrisome in the variants. Now, here's here's the good news on the variants. We've had variants circulating in Alberta since the beginning of January, brought in by travel. And I know there were some folks out there who were predicting on Twitter that we were going to, by the end of February, 2/3 of our cases would be variant cases, and we'd be in a straight climb up in terms of cases. That thankfully they were wrong. Thankfully, I think in part through super aggressive contact tracing, we've been able to pretty successfully contain those more contagious variants. But we've gone from an average of about 12 a day to about 24 a day, and that is that if those variants take off, they can just take off in a straight line up. So we've got to watch that very carefully. That's what we're doing. And Rick, I would also put this in perspective that by and large, our restrictions now are about where British Columbia is. So we are the two least restrictive provinces in the country. I know that's no consolation if you own a movie theater or a conference center. But over 99% of Alberta businesses are able to operate now within public health guidelines, and today a very important lifeline for the owners of fitness businesses, including gyms, in that respect.
If I could as well, before the next question, Rick, just because this is something you and I talked about before a few weeks ago, but just a reminder that our leading indicators wouldn't be increasing if we received in February the same number of vaccines that European countries got.
Yeah.
And just to remind people that Rick, vaccines equal freedom, and the fact that we were not given in February the same number of vaccines that we were originally told should be expecting is a bit of the problem as well.
Operator, can you please put through our last caller?
Stephanie Rousseau, Radio-Canada.
Bonjour, ma question est pour le Premier ministre. Je voudrais savoir, M. Kenney, pourquoi est-ce que vous allez de l'avant avec la phase 2 alors que le taux de reproduction, le taux de positivité aussi ont augmenté là, au cours des derniers jours? Et aussi, pourquoi vous ouvrez, mais vous ouvrez pas complètement, par exemple pour les sports de haute intensité ou pour les salles de banquet? Pourquoi avoir fait ce choix-là?
Merci. Nous prenons une approche très équilibrée, très ciblée. Évidemment, nous voyons seulement 250 personnes en hôpitaux avec le COVID-19. Ça veut dire que nous avons énormément de capacités supplémentaires maintenant, mais nous voyons une petite augmentation dans le taux de positivité. Alors, c'est la raison pour laquelle nous continuons avec notre approche étape par étape, d'une façon très prudente, avec seulement 2 mesures que nous prenons aujourd'hui. L'ouverture de plus d'activités dans le domaine des gymnases et des sports et pour les bibliothèques. Alors, c'est une épreuve que nous pouvons avancer avec le plan, mais d'une façon très prudente. Okay, thank you very much, everyone.